I'm Amber Hewitt, Director of Health Equity at Families USA. Over the past several months, our nation has grappled with the devastating effects of the COVID-19 pandemic. We're at a critical moment of reflection about the state of our healthcare system, public health infrastructure, and the social and structural drivers of health. The COVID-19 pandemic has shed light on existing health and healthcare disparities. Preliminary data across states show higher infection rates and deaths in Black and Latinx communities. Racially disproportionate data are evident across the country, from New York to Louisiana to Detroit and Milwaukee. We've also heard many reports about the connection between COVID-19 health outcomes and pre-existing health conditions such as diabetes, heart disease, and asthma. We also know that those comorbidities are concentrated in communities of color. It is time to shift the narrative beyond the social conditions of vulnerable communities and the structural drivers that created those conditions. We cannot talk about health disparities without talking about implicit and racial bias in healthcare, or policies like redlining, or the realities of voter suppression, mass incarceration, and generational trauma. The evidence is clear and must be put in the appropriate context. In addition to racial and ethnic disparities, reports show how language access have prevented patients from receiving proper diagnosis and treatment, and how human and civil rights of individuals with disabilities are threatened. These injustices are unacceptable. Now, this part is important. There is a fierce urgency of now for policy solutions that address the pandemic and accelerate health equity. At Families USA, we're calling for evidence-based policy solutions, including protections for essential workers serving on the front lines, ensuring equitable access to affordable health insurance coverage, ensuring healthcare inclusion for immigrant communities, resources for language access, ethical allocation for critical care resources, and the reporting and analysis of comprehensive data on race, ethnicity, and primary language. I invite you to join us in this movement where we can work together to address the determinants of health for those who have been historically ignored and excluded. How Congress acts now at this moment will impact the health equity movement for decades to come. For more information on Families USA, visit us at familiesusa.org or at Families USA on social.